Thank you, Wen.
And can I present the next speaker? I don't know if
Yeah,
Dr. Rafmin, go
I
ahead,
am here.
please.
Yeah,
Yeah, go
yeah.
ahead.
So,
Do you
well,
want to?
so I'm going to introduce, yes, the next speaker. Great talk, Paolo. Actually, good to see you. It's Claire from Kigali. Yeah, so our next speaker is going to be Karina Martins from Recife, Brazil. Actually, it's going to be a good continuation of just what Paolo just said. So she's going to talk about no finish line for learning. So, Karina, go ahead.
Okay, I'm trying to share my screen. Please bear with me one moment. Let's see if I can get this one right. And meanwhile, I would like to thank everyone for this invitation. Let me see, not this one. Thank you very much for this invitation. I think my presentation is at the end. Let me do it again. And bear with me one second.
Yeah,
Meanwhile,
I'd like to take this time, while you're preparing, to thank Professor Sharif for allowing us to be part of this wonderful virtual conference, and also thank Imad for helping, technical, help and managing everything. It's a lot of work. So thank you to both of you. So, thank,
let's see. Which screen do you have right now? Is it okay? Can you hear me well? Can you see my presentation? Is
wonderful.
it all right?
Yep.
Great, thank you. Sorry to be spending these 5 minutes. My name is Carolina Martins, and I am a neurosurgeon from the Northeast Brazil, and my task today is to ask this question. Is there a future for microsurgical neuroanatomy? And Wen has asked me to to share a little bit of my view, because in the year 2000, 25 years ago, when I finished my residency program, and been already working as a neurosurgeon, Professor Albert Broughton Jr. was already the father of microsurgical neuroanatomy. And in fact, Dr. Broughton had already been working in microsurgical neuroanatomy for over 30 years. I was a small kid when he established his Center for Microsurgical Education at the University of Florida, aiming to, at every second of every day, that a neurosurgical patient anywhere in the world would benefit from the knowledge of microsurgical neuroanatomy, a very, very global neurosurgical leitmotif. And he also had, by then, over 50, almost 80 fellows from all over the world that have worked with him. And it's probably because of these reasons that people started asking me, what are you going to do there? Everything in anatomy has already been done. Get a book, study by a book, and go on. But my view then was very clear, very sharp. I knew that Dr. Roton's work in microsurgical neuroanatomy was a response to a deep need for better knowledge, not of neuroanatomy, but of microneuroanatomy, of the nervous system, created by the introduction of microsurgical techniques, created mainly embodied in the person of Professor Yazagil by the bringing of the microsurgical microscope, extra light magnification, right? And I had seen with my own eyes in my country, with the work of Professor Evandro de Oliveira, how this could change neurosurgery, right? Could make it more accurate, more safe. So I was not wrong. When I started working with Professor Roton, I improved my knowledge of anatomy required to improve endovascular procedures. We revisited anatomy that had already been known for a while, but now with the eyes of an endoscope, either in the ventricles or along the skull base. And not to mention the fiber tracts, because by that time, tractography was coming up, so it gave it a very big impulse. And with the help and guidance from my fellow friends, Professor Wen as well, we started the whole body injection project that opened the Rotonian area for explorations in peripheral nerves and spine. And when I mean spine, I'm saying from up, down, and through in a wonderful work that sadly was stopped when the lab in Gainesville eventually closed. But this is my experience, right? You don't need to believe in my account or to take my account to you. You may want to look for yourself. This is what young people do, right? And you may do research. You may look for yourself and do search using two words, using microsurgical anatomy, and you will get great many of papers if you look 60 years. And what you will notice in this curve is that every decade there is an increase, a step increase in new material coming up to our field. And you may say, well, but this curve is too broad. Well, let's narrow it down. Let's take out anything which is not human. It will go down a little bit in numbers, but the tendency is here, right? And it follows, if you look closely, follows very much the landmarks, timeline of Professor Broughton's work. But we can even narrow it more. We can look for microsurgical neuroanatomy. And if we do this, you will see that this word did not appear in the literature before the 90s. It really comes up in 1991. It starts to become constant. It starts to increase bit by bit while Professor Broughton was alive. And after he passed, if you think that it went down, no, it went up all the way because there is a crescent need to understand microsurgical neuroanatomy when different technologies, different procedures, different concepts are introduced in our field. Well, but we may don't go to all this trouble, right? To look 60 years, let's narrow it to look only at the last part, at the last 5 years in this search. So if you have been considering coming to the lab to dedicate yourself to further understanding the crown jewel of creation, the reason for our daily work and toils, which is the nervous system, and have been disavowed like I was on the account that everything is already known, please consider that only in the last 5 years, there has been a steady flow of knowledge on microsurgical microneuroanatomy that makes our procedures safer. And that has taken place in several impactful journals in our area. And so my advice to you, look for a lab close to you. You've heard Paulo. You know what the lab can give you by now. Look for a lab close to you. If you need help, you can find some help through the International Broughton Society or through the Yazagil Microsurgical Anatomy, which are societies established by the fellows of these two professors, and even with the help of our host today, which is the World Federation of Neurosurgical Societies. And I would like to finish this talk, and my time is almost up, with the words from Professor Broughton. He used a few words when he was asked if his work in making neurosurgical accurate, gentle, safe by learning microsurgical neuroanatomy in the lab was close to an end. Dr. Albert Broughton Jr. simply said, there is no finishing line. So keep this in mind, and thank you very much for having me.
Go ahead, Claire.
Yeah, well, that's a nice talk, Caroline. It's always amazing seeing the work you're doing, what Power is doing. I think we all need to learn from the lab so we can make our patient more safe. So it's really inspiring. So I was told by Imad that we don't have an interview section, and Professor Wen, are you going to give a talk?
What I think the next one is